Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today, joined virtually first by Lauren DeMoss, a Maynard Nexsen healthcare attorney in Birmingham, Alabama. Lauren, great to be with you.
Thanks so much, Heather. It's great to be here.
And in person, it's great to have back across from the table, Darra Coleman. Many of you may remember Darra is a former Maynard Nexsen healthcare attorney who actually helped us start the podcast during the pandemic in 2020. And Darra, it's hard to believe we're over 200 episodes in.
That's so exciting.
It is. We welcome you back. We know you used to be with LLR, Labor Licensing and Regulation, and now you are Senior Associate General Counsel at Prisma Health. As we get started, tell us a little bit about this current chapter of your life.
Well, first of all, thank you so much for having me back. And thanks for the opportunity to tell you about the work that I do at Prisma Health, because we're obviously very proud of the accomplishments of Prisma Health. And I'm just very grateful to be there. As you know, Prisma is the largest healthcare provider in South Carolina. We have 18 hospitals and over 300 physician practices across the state, and we're growing every day. So every day we touch thousands of patients and all of the issues that come with them. So my job is patient-facing. In the course of a day, I can do anything that ranges from privacy issues to resolving conflicts between patients, and providers, answering a variety of questions for them, resolving issues that they may have as they come into a relationship with any aspect of the services that we provide. But it is truly an honor to be part of the Prisma Health family, because we offer so many different services to our communities, and we are so invested in the communities where we sit. So thank you just for the opportunity to be an ambassador for Prisma Health.
Well, you're a people person, so it's great to hear how your career is morphing. And I was telling Lauren how personable you are.
Oh, well, thank you. No pressure.
Yes, no pressure.
No pressure. Darra, it's my understanding part of your job includes interacting with patients and families as they navigate the healthcare system. It's a very complex system. So can you talk to us a little bit about what that part of your job looks like and what kind of resources are being provided for patients?
Sure, Lauren. As you may know, as a healthcare attorney, the very first challenge is overcoming barriers to access to care. So we want to bring the community into a trusting relationship with Prisma Health. And oftentimes that means we have to go to them. So Prisma Health is fully invested in going out into our communities through mobile medical services. And we have a number of initiatives that are designed to do that. We actually have a statement of our purpose, which is also our promise to our patients, because we are committed to ensuring that the patient experience is a positive one. And it's comprised of 3 statements: inspire health, serve with compassion, and be the difference. And that truly defines the patient experience. So once we bring them in to our relationship, we understand that they have a choice. And once they have chosen to come to us and entrust us with their care, we then feel an obligation to be completely transparent with them. And that is from the get-go about pricing, and also in communicating with them about every dimension and aspect of their care. And that also includes having difficult conversations with them. So if there is a diagnosis that is not necessarily a positive one, or if it's a complex situation, we try to make sure that we have educational resources available to the patients and their families. In both the inpatient and outpatient setting, our patients also have access to their charts through MyChart. If they sign up for that, that's a choice for them. But they have immediate access to their own records. And so that access to education and information, I think, is so important to helping them navigate the pathway. For our patients who are struggling financially, we offer support through our financial services. It's available online. You don't have to have the embarrassment of applying or asking for help face-to-face. You can do that online and get the help that you need. We also offer emotional support through chaplaincy and through other support mechanisms that are available. And those also can be accessed and identified online if that is more comfortable. Through telehealth services, people can receive some healthcare services in the privacy and convenience of their own home. So patients feel empowered that they get to make choices, that they can dictate some aspects of situations that often feel like they have no control over. And so we want to empower the patients and give them as much autonomy as they can have, because transparency and trust and truthfulness, I think, are the components to having a positive patient experience overall, because we are in it for the long haul. We don't want our patient experience to be short term, nor do we want it to be limited to just one person in a family. We consider it an honor and a privilege to treat these patients, and so we take it very seriously. We do some really neat things to try to bring patients into care. For example, we've identified patient populations who struggle, such as African American women who may be interested in pursuing doula services when they are planning to deliver their babies. So we've set up a grant program to support their access to doula services. And that has been amazing in terms of bringing women into prenatal care who may not have otherwise trusted the system. In a post-COVID world, I don't know if y'all have heard this term PANGER, but it is a term that psychiatrists and psychologists are very well aware of. The medical literature is talking about it now, but PANGER is like post-pandemic anger. And it's something that has bled into this clinical environment. Also, I think it's in our basic interactions every day where people are much more easily triggered. And so I think we are seeing patients who are less likely to trust institutions and hospitals, organized medicine. People who wear white coats have to work a little harder to gain the trust of patients and overcome that PANGER. And so we are working very hard and very diligently to build patient-centered strategies, both inpatient and outpatient, and in every encounter that we have in our communities to overcome that.
Now, it's, again, great to hear you focused externally on people, but take us back. You were with LLR first, Labor Licensing Regulation, and you were working for the government and regulation focused.
Right.
And then you went to private practice.
Right.
And now you're working in-house. What new are you learning? Or how are you seeing your past skills used in a new way?
So this is such a fun and interesting question, Heather. Before I came to law, much less healthcare law, I was trained as a teacher. Then I started out doing civil litigation, then I became a mediator, and I kind of stumbled into regulatory work, then healthcare work. All of those experiences, I think, were building blocks to prepare me for this. So I'm still doing regulatory work. I still do licensure defense. I still deal with state agencies. I am still very much involved in administrative law and regulatory compliance. But looking at those issues through a different lens. Now on a regular basis, I am dealing more with federal compliance issues much more frequently than I did previously. And also I'm doing a lot more of probate law in terms of working to establish guardianships and conservatorships for patients who have no voice. These are folks who have lost the capacity to make their own medical decisions and who have no family members, no friends, no contacts within the community or with their previous caregivers who are willing or able to stand up and serve as surrogate medical decision makers. And in those instances, Prisma Health will formally step in and we will ask the probate court to appoint a professional guardian, because South Carolina does not have a publicly supported guardianship program, unlike some other states who do that. And in that case, an attorney will be appointed to serve in that capacity, and that means that Prisma is then wed to that patient until they die, basically. Because even after they are discharged from the acute care setting, we still continue to have at least a financial relationship with the folks who are appointed to serve in that capacity. That has been an interesting area of the law for me to learn. And also, I've learned a lot about the services that are provided in our state and the services that are not provided in our state to intellectually impaired individuals, particularly the adolescent patient community. We've had some very interesting cases where we've had to create solutions that simply did not exist, where we had patients who were falling through the cracks of services that were available by the state agencies who were funded by state funds and charged with the responsibility of providing resources for these vulnerable patients, yet were with us and didn't need to be in an acute care setting. So we're learning a lot about state agencies that I thought I knew about before, but knew nothing about prior to being placed in this role. And so that has been an interesting aspect of it. And as you know, I previously represented physicians and nurses, other healthcare professionals, also thought I knew a lot about what they do. I have a brand new appreciation for their compassion and their commitment to delivering healthcare services, being on this side of it. There are two committees that I support on a regular basis, and those are the Ethics Committee and the Workplace Safety Committee. As you know, the U.S. Department of Labor published statistics recently that confirmed that healthcare workers are 5 times as likely as any other industry to be injured at work. Workplace violence occurs with our healthcare workers 5 times as likely as any other industry. And so what that tells us is that these folks who are healers, they go to work every day with the intent to heal and help those who are sick and vulnerable, are exposed to danger. Now, I don't know about you, but when I get up and go to work in the morning, I don't worry about being assaulted. I don't worry about being harassed by the people I'm trying to help. But that is very much a reality for our healthcare workers. And similarly, they are often confronted with dilemmas that we, in most of our industries, most of our workplace settings, are not faced. And so through those two committees, I found a brand new respect and appreciation and desire to serve them in a way that I did not have before. So every day, I'm very grateful for the opportunity that Prisma Health has given me to serve these healers in a different way. My mission was never to be one of those people, but I definitely feel like my calling has been to serve them so that perhaps their job can be a little easier.
Well, they're fortunate to have you.
Oh, well, thank you. You're very kind.
You know, Darra, speaking of every day, healthcare in a hospital in particular kind of never closes. It's definitely a 24/7, 365 business. There are no business hours. So thinking about your role there in house counsel at a large hospital, how has that been an adjustment, and how do you kind of manage that schedule? And have you had kind of middle of the night weekend fire drills that take some, and we have that in private practice too, but healthcare never closes.
Oh, absolutely. Lauren, it is different. It's similar in that you're constantly triaging, just like you do in private practice, where you have to prioritize the needs of your clients. But it is different. We have a small legal team, so everyone is working very hard all the time. But of the 6 lawyers on our team, I am the only one who primarily is responsible for the patient-facing services. So I do take middle-of-the-night calls on weekends, and our team members are so respectful of my time. And I know that when they call me in the middle of the night or on a Saturday or Sunday, it's because they really need that support. They really have something important. But just in case, I do get up every night between 2 and 3, and I check my emails to see if someone has emailed with a question. And I always respond in the middle of the night, because the folks who are working that 11 to 7 shift, they need answers too during that shift. And it may be something that can't wait until 7. Some of the questions are funny, kind of funny, but some of the questions are really, really serious. And it's no different than when you're dealing with something in private practice, except that the nature of the consequence is different. When you're a healthcare attorney in private practice, usually what is at stake is either financial or transactional. You know, the consequence is not necessarily life or death. But when you are in-house for a healthcare system, the consequence really can have a permanent impact on an individual or a family or on your provider. And so it's a combination of law and medicine and something else, because you're trying to sometimes minister to the needs of the provider who's calling you on the other end. Sometimes they just need reassurance. But yes, the middle of the night and weekend calls do come, and everyone on our team is truly an asset, and we try to take care of one another. So I think that is the blessing of having a small team. The long hours are the challenge, but it's a great team environment.
At the beginning, you spoke about how your employer, Prisma Health, is growing.
Yes.
And I know in particular, opening new urgent care and outpatient care facilities in the Midlands.
Yes.
As well as the state's first inpatient pediatric rehab unit.
Yes.
Talk a little bit about this, if you would, about growth in the state.
Well, it's really exciting. It's an exciting time to be with Prisma. And just this past week, we opened 2 new imaging centers, one in the Midlands, one in the upstate. And further expansion will be coming in our physician practice network with more urgent care centers planned to come. This fall, we'll have a new behavioral health center in the upstate. We will have an IOP offering for women, and this is so exciting, who were identified as suffering from substance use disorder during their pregnancy. And this is the first opportunity in the state of South Carolina where women can bring their babies with them. So that barrier to care is being removed. There are very few programs in the country that are offering this to women, but we will be the first in the state. That should open in November. And then next year in Oconee, we will have a crisis stabilization program in the Oconee ED. There are so many new initiatives that are going to be unfolding in South Carolina in the next 12 months. It's hard to think of them all, but in pediatrics, oncology, neurology, and there are medications and medical devices, programs that will be announced in the media that I'm sure you'll read about when they come. But it's an exciting time to be in South Carolina.
You know, in addition to the expansion and kind of Operation South Carolina, it was announced in July that Blount Memorial Hospital in Maryville, Tennessee will join Prisma Health, and it'll be the first hospital outside of South Carolina. Can you tell us a little bit about this deal and kind of the impact on both Prisma and Blount Memorial?
Sure. Lauren, all I can confirm is that Prisma Health and Blount have signed a non-binding letter of intent and have now entered a period of negotiations and due diligence, which is well underway. And you may already know, but just this past week, some exciting things happened at Blount. They celebrated their 77th anniversary. And also they announced that CMS recognized them with a 4-star facility accreditation. So we are delighted, as we're undergoing the due diligence process, to recognize their longevity and their commitment to high quality delivery of healthcare services, because we do think that that aligns with our purpose. As I mentioned, that 3-sentence statement says so much: inspire health, serve with compassion, be the difference. I think the things that you can learn about Blount are consistent with that purpose. And for us, it all comes back to that. It all comes back to having a patient-centered focus. And as we expand, hopefully that will be something that we can replicate in honor of that purpose.
Well, it sounds like you will continue to be answering your emails at 2 a.m, even more so the way that you are adding services at Prisma. But they're, again, fortunate to have you. We're just grateful for you to come back and to hear what you've been up to. Lauren has filled your shoes well, but you are still part of our family with helping us start taking the pulse. And so it's just great to see you. Thank you for joining us.
Well, thank you. It's been great to watch Lauren and to learn from her. I've watched the podcast all the time, and I always learn something new from you, just like I learn something new at work every day. So thank you for carrying the torch forward. It's great to be here. I appreciate it.
Well, on behalf of Lauren and our whole team, we want to thank everybody for joining us today and enjoying this episode. We hope you learned a little bit more about Prisma Health and enjoyed hearing what Darra is up to now these days. We look forward to seeing you next time, right here on Taking the Pulse, a healthcare and life sciences video podcast.